Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Let's look at the Plummer-Vinson syndrome. So Plummer-Vinson syndrome, it is also known as the Patterson-Brown-Kelly syndrome. The Patterson-Brown-Kelly syndrome, or it is also known as the sideropenic dysphagia. So it is most common in the middle-aged edentulous females. There is increase in the risk of the squamous cell carcinoma in the oral cavity and the hypopharynx, as well as in the esophagus. The features of the Plummer-Vinson syndrome, it includes, there is a splenomegaly, there is achlorhydria, there is dysphagia, there is also the chronic iron, there is also the atrophic oral mucosa. Next, when you look at the treatment, before the treatment there is the koilonychia as well, another feature. So treatment is by the treated effectively with the iron supplementation as well as the mechanical dilation. So iron treatment as well as the mechanical dilation. To learn and grow daily like this, please do subscribe.